will appear. And now I'd like to introduce Dr. Jacob Teitelbaum. Dr. Teitelbaum?
Hi, great to be with you, Cheryl. And also, what I'd like to do is to take a moment and introduce Dr. Neil Nathan. Neil is a remarkable physician. I know over the last 35 years what I did is I took the work of Dr. Billy Crook, Dr. Janet Travell, and a host of other doctors and integrated it into what we call the SHINE protocol we'll talk about today. And now Neil is taking my work, the work of Richie Shoemaker, Amy Yasko, Joe Burriscano, and a host of other experts, and he has now been integrating all of that to go ahead and take the work even up to the next level. So we're in for a treat today because Neil will be giving some very educated and informed information from a wide view of experts. He'll talk about how to diagnose Lyme disease, how to make it through this maze of some of the controversy going on, and then how to treat it and some of the co-infections. And then after his talk, what I'll do is talk about a very important point that goes on with Lyme, especially in chronic Lyme, which is that it usually will trigger a secondary fibromyalgia. So if you find that in addition to fatigue, pain, cognitive issues, all the rest, you have trouble sleeping, that's not Lyme disease. That's a secondary fibromyalgia. And the nice thing is when you treat that, what's been called Lyme often goes away. And we're going to teach today how to treat that effectively. So let's take it away with Neil. Neil is awesome. So Cheryl, why don't you go ahead and pass the talking stick over to Neil.
Thank you so much, Dr. Thank you so much, Dr. Teitelbaum. What a wonderful introduction. And welcome, Dr. Nathan.
Good morning. Thanks so much. And thank you, Jacob, for your very kind introduction. So we're going to talk about Lyme disease today. Jacob and I have presented before in the past, and I hope that we will together help you all to understand some of the complexities of what we're going to be talking about today. So I'm going to launch first into a discussion of Lyme disease. We can talk for days about Lyme disease, so a 40-minute presentation is going to be nowhere near enough to even begin to get into the details of what we need to. But I would love participants to understand real basics, like what are we talking about? It is a hugely missed diagnosis. It is very important, and if our listeners can really understand that, then they can understand how this connects very, very closely to Jacob's work as well. So hopefully we can proceed with that. I am brand new. I am a virgin webinar presenter. This is my first, so be gentle with me today in terms of my ability to communicate this. So let us launch into Lyme disease and talk about it. It is very controversial. I do not want to present that what I tell you is the truth. There are as many different opinions about Lyme disease as there are people practicing. But the real basics is that Lyme disease is caused by the spirochete, which is a bacteria called Borrelia burgdorferi. We immediately begin to get into complications because in conventional medical thinking, a tick bite results just in Lyme disease, meaning if you're bitten by a tick and you get what is called the classical bullseye rash, then it is thought that you probably have Lyme disease and you should be treated with an antibiotic. However, many people are not aware that when the tick bites an individual, what it really does is the first thing a tick does is it sucks your blood. Sorry for the graphic nature of this description. It sucks it into its stomach where it sits for anywhere from a few hours to a few days before the tick regurgitates its contents into the area of the bite. All of the things I just said are controversial, and I will talk about it in more detail. But because of the way the tick regurgitates its contents, it doesn't just inject the Lyme disease bacteria into the body, but it also can inject a variety of other infections, most notably Bartonella, Babesia, Ehrlichia, mycoplasma, and a wide variety of other materials, some of which we've not even completely identified. Dr. Borrescano, who's one of the deans of Lyme disease education, calls the tick nature's dirty needle, by which he means when you get a tick bite, you don't know what you've been injected with sometimes until quite a bit later. And that's the key point here. Since I'm mentioning that at this particular point, I just wanted to add that many emergency room physicians are under the impression that if a tick has not attached to a person for more than 24 hours, many people are told you can't possibly be getting Lyme disease because the tick has to have been attached at least that long. Unfortunately, as far as I can tell, ticks don't have stopwatches or timepieces. They don't really sit down and go, oh, I guess only 12 hours has passed. I guess I can't quite regurgitate my contents into that person yet. And we have documented cases of ticks doing this in much less period of time, including periods of time that are 2 or 3 hours. So first of all, if someone tells you or someone you love that you can't possibly have Lyme disease because the tick was only attached for 8 hours, that is not reassurance. Very simply, we break Lyme disease up into early Lyme disease, disseminated, and chronic. All of these are controversial. But we do know that the sooner you get on top of treating Lyme disease, the faster you can get cured. And it does appear, and we don't know why, that if we aggressively treat the Lyme, even if it injected some of these other co-infections into the body, if we can get the Lyme controlled early on, the others don't seem to manifest either. So the biggest controversy here is whether chronic Lyme disease exists. There are two major players in this controversy. The Infectious Disease Society of America does not believe that there is anything called chronic Lyme disease. They believe that after a tick bite, people can get sick and stay sick for long periods of time, but they call that post-Lyme syndrome to distinguish it from the possibility of having an active infection. And they are of the very strong opinion that use of long-term antibiotics are not helpful in these cases, and that really it can't be treated. I mean, basically, if you get the diagnosis of post-Lyme syndrome, the implication is, well, go home and suffer because there's nothing anybody can do for you. The International Lyme and Associated Disease group, which is ILADS, and it is a group to which I belong, so I will clearly state which group I am akin to, is of the definite opinion that there is such a creature as chronic Lyme disease. It can be treated, and that Lyme is actually an epidemic, not minor, and needs to be really looked at. Just to give you a little flavor for tick bites, the point of this slide is to show you how small certain ticks can be. You can notice that some of the ticks are relatively large, but this is all compared to the size of a dime. And you can see that some ticks, the larvae particularly, are so small that they can easily be mistaken for a freckle. Again, the teaching of some people is that the only stages of Lyme disease, the only stages of a tick bite that can transmit Lyme disease are from the larger phases. And we have evidence galore that that is not true. Virtually every type of tick can transmit Lyme disease, and it can be transmitted by virtually any stage or size. So this means that for those of you who live in the woods, which includes me, you need to be vigilant about checking yourself after hikes or walking in tick-laden areas. For many of us who have dogs, for example, many of us protect our dogs with use of things such as Frontline. Now, Frontline discourages a tick from biting, and so your beloved dog will come into your home, the tick will happily drop off of the dog and then find you. So many people have had their beloved pets bring the ticks into their vicinity, and certainly that has been the case for me. And again, this just gives you a picture of the ticks. You can see on the left side the size of the tick, and you can see what a tick like when it is engorged with blood. You can see how it changes what it looks like from what is obviously a tick to something that is looks really quite different. And I'm going to go scooting through that. Okay, so we have this huge controversy, and happily, after fighting with the medical establishment for 20 years about the existence of chronic Lyme disease, in August of 2013, almost a year ago, the CDC, for the first time, announced that there were 300,000 new cases of Lyme disease discovered each year. And although that might not seem like a particularly big deal, this is the first time that a public health national agency has admitted we have an epidemic. And although you see on this map little dots that indicate the prevalence of Lyme disease, and you can see on the map the presence of a marked bluish coloration in the Northeast and in the Minnesota area, I can assure you that there is massive quantities of Lyme disease in California and in virtually every state, and in fact every part of the world has had Lyme disease reported. So please understand, do not look at this and go, oh great. For example, if you look at Wyoming or Colorado, it looks like, wow, there's many Lyme disease there. In many states, it is not mandatory to report Lyme disease. For example, I lived in Missouri for 15 years and practiced there. You can see only 3 dots in Missouri, but I can tell you that the State Department of Health publishes newsletters which announces in a non-reportable disease the occurrence of 150 to 300 cases every 6 months, which we believe to be way underreported. So the bottom line here is no matter what state you live in, the possibility of Lyme disease is very, very prevalent. A couple of other concepts about Lyme disease which are very important to be aware of. For many people, they think that you have to have a bullseye. We have a picture of it on the screen in order to have Lyme disease. Well, the research that has been done shows that the bullseye rash is present only 30% of the time, even in confirmed cases. In fact, in confirmed Lyme disease, only 17% of people actually recall a tick bite. So not having a bullseye is not proof positive that you do not and will not get Lyme disease. In fact, if you do have a Lyme disease, by every state health department, you have Lyme disease. This is evidence, absolute, incontrovertible, that if you have the rash, you've got Lyme disease and you'd better get treated. So then we begin to get into the concept of, okay, if this is really hard to diagnose, and I assure you that it is, if you go to an emergency room or if you see a physician, they may offer you a variety of tests. The first test is the screening test, which is an antibody test. Unfortunately, the vast majority of conventional physicians and emergency rooms use this test as their primary interaction with Lyme disease, and unfortunately, that test is pretty close to worthless. Of the thousands of people with Lyme disease that we have treated, perhaps 3 to 5% have a positive screening test. So if you've been told that you have been tested for Lyme disease, one of the questions you want to ask immediately is, what test did I get? Because if you had a screening test, this antibody test, which many physicians use as, unless that's positive, they are not going to go on to additional testing. So if you have had that test and it is negative, in no way are you safe that you don't have Lyme disease. Sorry about that. So when I made this slide, which has changed recently, I put down that the best or only test that was even decent for Lyme disease is called the Western blot test. And I will, in a few moments, show you a slide that shows you what it looks like. And I have a very important reason for showing you what the actual slide looks like. Now, you can get a Western blot test from the conventional medical laboratories like Quest, like LabCorp. Unfortunately, those tests have left out intentionally 3 of the major criteria that help us to diagnose Lyme disease. And there's a reason for that. Back in the late 90s, a vaccine was made for Lyme disease. And the vaccine, to help protect people against Lyme disease, it was thought that those 3 particular components of Lyme disease would make the basis for an excellent way to protect people from getting Lyme disease. It was a very nice idea. Unfortunately, it did not work out that way, and it turned out that up to 20% of the patients who got the vaccine had a Lyme disease-like illness. It was horrible, and the vaccine was removed from general distribution very, very quickly. Unfortunately, that never translated back into the conventional lab testing. So Quest and LabCorp Western blot testing does not include those 3 specific components of the vaccine, so that it is not the best test in the world. Better than an antibody test for sure, but it's simply not the best. The laboratory that includes this testing is IGeneX. So those of us who work in the Lyme field for many years have felt that the gold standard for testing for Lyme disease is the IGeneX, IgM, and IgG Western blot. That test is, by my reckoning, roughly 50 to 70% accurate. Now, that's way better than what we used to have, but it is not accurate enough to truly rule out Lyme disease. That means it's 30 to 50% inaccurate, and that means that there's a distinct possibility that even using this excellent testing, the diagnosis of Lyme disease could be missed. To make this a smidge worse, one of the reasons for that is the hallmark of Lyme disease is that the Lyme bacteria has a profound effect on the immune system, weakening it to the point that the body may not be able to make these antibodies. So it is not unusual when we suspect Lyme disease. If we suspect it strongly, we will notice a negative Western blot, but after 6 months of antibiotic treatment, after we have improved that immune system, it will now make a positive antibody and the test will turn positive. Well, one new good piece of information is for the last several years, there has been a newer test that we have had available called the Advanced Laboratory Lyme Test, which is a blood culture for Lyme. The Western blot only tells us what the immune system thinks it's doing with Lyme. It does not tell us whether it is old, new, acute, chronic, or even cured. The Advanced Lab test actually cultures the bacteria from the blood. We have been using this as our preferred test for the last several years now, and it looks like, as the lab claims, it is 93% accurate. So again, not perfect. It is much better. And it is not in question. If we can grow Lyme bacteria from your blood, you've got it. So sometimes we are left with, as this shows, the final bottom diagnosis is, the bottom line is, we sometimes have to make this diagnosis clinically because we may not be able to make it by actually using the laboratory. So now let's get into how will Lyme manifest. And here I want to point out that Lyme is what we call the great masquerader, meaning it can look like anything. Perhaps reminding you that Lyme is a spirochete. The most similar bacteria that we've got to Lyme is syphilis, which many years ago was also called the great masquerader because it could get into so many tissues and do so many different things to the body that virtually any symptom could be masquerading as syphilis, and in our case, Lyme disease. The one thing that I really would like to emphasize here, although it is not the primary subject under discussion, is that mold toxicity has been recently discovered to be equally a masquerader for similar reasons. So although mold is a toxin and Lyme is an infection, and you might go, well, why would a toxin and an infection look the same? The answer is that both promote an out-of-control inflammatory reaction in the body, and that the cytokines, which are the inflammatory chemicals that the body makes, are close to identical for both conditions. So one other big, huge piece, which we will probably not be able to talk about much today, is that also think about mold toxicity when you're looking at the very unusual constellation of symptoms that we have got here. Okay, so this is what a Western blot looks like, and I'm just going to go over this quickly so I don't get caught up in the details. But I'm going to try to use this to explain why these are not easy to read. For example, if you look at the very hard lines, let me see if I can do this here. You can see that this is a dark band right next to the right of that particular dot. And let me, I can do this. And this is a very light band. Let me see if I can do that. There we go. You see how light this band is to the right of that? When the lab techs read these, the very, very strong one is an obvious positive band. But the very, very light one is, I don't know, is that a band or is that not a band? And the answer to that question is that is very hard to tell. So these are what is read as indeterminate. So when we are stuck with reading these, when you get a reading back and you get an indeterminate reading, it can be very hard to know what that actually means. Is that a positive? Is it a negative? It is weakly positive, very hard to say. So just to help those of you who are looking at these bands, many physicians do not know how to read them accurately, because these bands, which are these little dark areas that you could see on the previous slide, bands are simply pieces of protein to which the immune system may react by making antibodies. So some of these bands are not specific for Lyme at all, and some of these bands are highly specific for Lyme disease. And so on this slide, I've simply highlighted how we look at it, so that when we read these particular reports, you may have some positives, which we would say is, that doesn't prove Lyme at all, or you might have just a few of these bands positive, but that they are so specific for Lyme that it makes us really convinced that this is a strong possibility. There are some other tests for Lyme, but I think I'm going to ignore that for now so I can move ahead to some more important questions. So one of the questions that comes up to everyone is, why do Lyme patients get so sick? Because those of you who've heard of chronic Lyme, perhaps you have it yourself, or you have family members or loved ones or friends who have it, Lyme patients get really, really sick. And so these are some of the reasons for it, which I'd like to go into in a little bit more detail right now. Some of our patients have more infection in them. We're going to talk about the fact that the Lyme bacteria can change its shape and form. The Lyme bacteria can profoundly suppress the immune system and evade detection by the immune system. It will try to find places where the body can't find it or treat it. And to make all of this worse, Lyme disease rarely exists in chronic form by itself. Usually the co-infections are a major league component. So we have three main forms of the Lyme bacteria. We have the spirochete form, which is the one for which it's known. This particular form has a cell wall and is treated with specific antibiotics that I list below. In addition, when threatened, The Lyme bacteria is capable of changing its form into a form that is not responsive to those antibiotics anymore, called an L form, or some people call it a cell wall deficient bacteria, and that's responsive to other antibiotics. And to make this even worse, when threatened, the Lyme bacteria can move into a cyst form. Many of my patients have not understood that term. They will then point to little cysts that they can feel on their body and go, oh, is that the Lyme hiding there? Nope, that's not what we're talking about. These are microscopic cyst forms, and these respond to other antibiotics. So that when we're thinking about treating Lyme disease, it's not as simple as giving a single antibiotic for 10 days and getting cured. For complicated reasons, it's much, 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 much more complicated than that. One of the biggies is that the Lyme bacteria is one of the slowest growing bacteria known. And you might go, well, who cares how slowly it grows? Well, actually, the antibiotic and how you get treated from it does care. For example, if you had a strep or a staph infection, those organisms divide constantly, multiple times an hour, and all antibiotics work by killing the bacteria when it is dividing. So if you have a strep infection, you can be killing it multiple times an hour as it divides by taking an antibiotic, and you can get better in 24 hours sometimes. With Lyme disease, it divides roughly every 21 days. That means that if you were to take an antibiotic for Lyme disease, let's say you went to the emergency room and it was confirmed that you perhaps had Lyme disease, if you took antibiotics for a week or two, you might not hit that dividing period in that entire period of time. So one of the controversies is that Lyme, those who are called Lyme literate, MDs or DOs or people who treat Lyme disease, we normally say that you should be taking antibiotics for at least 6 weeks with each exposure. And the reason is we're not being mean and that we're not being cavalier about the use of antibiotics. That guarantees that we would hit at least 2 growth cycles. If you don't treat it long enough, that is why we believe some people who have been treated for 10 days with antibiotics will develop full-blown Lyme disease. This is really important for those of you to know, because if you are only being offered 10 days of antibiotic, please know this is not enough. Okay, in addition to hiding by moving into different forms, the Lyme bacteria has certain protective niches within the body. For example, these are intracellular infections, meaning the Lyme will go into a cell so that it is much less available to be treated by either your immune system or by antibiotics. This makes it, again, harder to eradicate. And Lyme will also particularly go into ligaments, tendons, nervous system, and the eye. That means that many of you have heard that there are different forms of Lyme disease. Some are called neuro-Lyme, meaning that the Lyme particularly affects the nervous system, and some types of Lyme disease are more joint-based in their effects, and that's why we see that. Okay, so we have this nasty, nasty illness, and I hope I will convey that to you even further and in more detail as we move along here. And it's not simple enough as to just identify these organisms, as I've tried to communicate. Making the diagnosis of Lyme disease is difficult. It is not simple. If we do make the diagnosis of Lyme and the co-infections, we want to treat them with antibiotics, herbal treatment, and that discussion is way beyond the scope of this particular presentation. But it's also important to realize that in addition to eradicating the infection, and eradicating might not be the right term, lowering the number of bacteria in the body until the immune system can recover is a more correct way to put it. But while that's happening, when the body, either by its immune system or by antibiotics, is killing these organisms, we release large amounts of toxins into the body, and those toxins have profound effects on the body that have to be taken into account, so that detoxification has to be an important component of the treatment. And to make this a little more complicated, and this is the part that Jacob will address in his presentation, when we have this, both the infection and the toxins inflame the base of the brain and the pituitary gland and interfere with the body's ability to make hormones, and interferes with the immune system, hormones, and the nervous system. And this weakened system, which is well identified with Dr. Teitelbaum's SHINE protocol, is something we have to treat also. So we have to rebalance the hormones, rebalance the biochemical perturbations that have happened, detoxify, and treat. You can begin to understand that this is quite complicated. It is not for the faint of heart, and it is not for the impatient. This normally will take in chronic Lyme disease, meaning Lyme disease that's gone on for over a year. It often takes several years minimum to do this. Okay, so this slide basically says the same thing. This is a complicated process. It requires a lot of patience, quite a bit of knowledge, a lot of compassion, and quite a bit of trial and error. Okay, so quickie. You've been bitten by a tick, and I've already freaked you out here. I didn't mean to do that, but I'm just trying to give you some good information. What do? It's very important that you clarify whether you need to be treated or not, so that if you can remove the tick, and that is not a hard thing to do, remove the tick, put it in a plastic baggie, and keep it. Do not throw it away. Do not squash it in a fit of rage, which I have done personally. Keep the tick and send it to either your health department or the Hygienics laboratory for analysis. You can go online, and the Hygienics lab will give you the information of how to put this plastic baggie into, or an envelope into another envelope, and mail it for analysis. If we do not find any Lyme disease in that tick, it is almost impossible, not impossible, but almost, that you'll have Lyme disease. So it's not necessary to go crazy with antibiotics if we know that the particular tick that you had analyzed did not carry it. So please do that. We've talked about some of these co-infections, and what I would like to communicate here is now, what are we looking at? I talked about this masquerading process. A huge number of patients come to see me because they have symptoms that literally no one can figure out. I would encourage you to look carefully at this list of symptoms: fatigue, low-grade fevers, hot flashes, sore throat, swollen glands, stiff necks, myalgia, which is tender muscles, tender joints. Here we begin to go, oh, it looks a lot like fibromyalgia or chronic fatigue. It looks exactly like fibromyalgia or chronic fatigue. So as Dr. Teitelbaum does his presentation, be aware that Lyme disease is a cause, as is Bartonella or Babesia, of fibromyalgia, so that we need to at least think about, if you have fibromyalgia, could it be Lyme disease? Do we need to be looking at that as something to treat? Because from my perspective, Lyme disease is treatable. So look again: chest pain, nausea, diarrhea, depression, back pain, heart palpitations, headache, vertigo, stiffness, memory loss, poor concentration, sleep disturbance, frank arthritis, looks like rheumatoid arthritis sometimes, abdominal pain, joint pain moving all over the body, ringing in the ears, jaw pain, dizziness, mood swings, irritability, blurred vision, testicular pain, specific nerve syndromes, particularly Bell's palsy, is often Lyme disease, paresthesias, radiculopathies, eye pain, pelvic pain. I noticed that one of the questions was about Parkinson's disease. Any neurological degenerative disease which does not look exactly like what it is supposed to. And by that I mean, if a neurologist diagnoses somebody with atypical Parkinson's, atypical dementia, atypical Alzheimer's, atypical ALS, atypical MS, the word atypical is a tip-off that this might be Lyme disease, and I will also add again, possibly mold, so that it is very, very common for Lyme disease to present as something that looks different. And this is really important. If you have an unusual manifestation and your doctors are not sure what it is and it's confusing, always think about the possibility of Lyme disease. Now, in the co-infections of Lyme disease, some of these manifestations point us in those directions. For example, in Bartonella, burning pain in the soles of the feet, paresthesias, which is a fancy word for numbness and tingling in different parts of the body, particular types of headaches, depression and anxiety, intense depression to the point of despair, anxiety beyond anything that people have imagined, not in response to stress, but out of the blue. The presence of skin rashes with little stripes or lines, unusual rashes that people can't identify. Think Bartonella. Babesia, the main symptoms would be sweating, chills, fever, a disconnect of the nervous system. People just don't feel like themselves are key there. So again, it's not my intent to diagnose it, but to really illustrate a wide variety of an unusual, weird symptoms. Think about it. I particularly want to comment on the paresthesias part of it, which is numbness and tingling. If you have numbness and tingling in parts of the body that do not correspond with what neurologists call dermatomes, meaning it's not directly in a particular nerve distribution, often neurologists will examine those patients and go, that's not possible. You can't have numbness and tingling in those areas. When you get that, think Lyme, think mold, because you can get it in that area, and that does happen. So I'm going to move through these particular slides because I've kind of reached the climax of what I kind of wanted to talk about. A couple of minor issues. Again, I'm not going to really talk about treatment in detail. Killing these bacteria, as I've tried to imply, is tricky and difficult, but it is doable. Lyme experts do not agree on whether Lyme can be cured or simply managed or maintained. It is my personal opinion that Lyme can be cured. I've had lots of patients 15 years after treatment have no manifestations on no antibiotics whatsoever. From my perspective, that's cured. Can I know with absolute certainty that there's not a Lyme organism in that body? No, I can't. But to me, that's a healthier way to look at it. There are other specialists, and you will read from other people that Lyme may not be able to be cured. Again, that would be a disagreement on my part. We have at this point, or I personally treated at this point, several thousand patients with Lyme disease, and the majority get anywhere from totally well to better. But not everyone, because we don't quite know how to cure everybody at this point. There's not a single one of us that do, but if you have not been treated adequately and thoroughly and completely and had all of these things looked at, there is hope. And that would be part of the main message I wish to give, which is if you have not been diagnosed and you have these weird symptoms, think Lyme, think mold, and have someone treat you who knows what they are doing. That may take some looking, but if you go to the ILADS website, there will be a listing of people who are trained in how to do this, and that's something you probably want to have looked at. Again, there's a wide variety of treatments. Some people are under the impression that treatment involves always intravenous treatments. That's not entirely true. I would say that personally, 80 to 90% of my patients are treated with oral antibiotics and get well. Sometimes when patients are sicker, when they have neurological manifestations, when they're not improving, it is important to provide intravenous antibiotics for various periods of time. There's also a wide variety of herbal, homeopathic, and machine-based treatments, including the Rife machine, which have a definite place in treatment. Lee Cowden's herbal protocol can be helpful, and there's a number of things that I list as naturopathic formulas, particularly the Byron White formulas and Susan McCamish's formulas, which are specific tinctures that help to mobilize these bacteria and infectious agents from their intracellular location so that the immune system can do more with it. So, bottom line, the symptoms of Lyme disease are almost indistinguishable from chronic fatigue and fibromyalgia because they have the same pathophysiology, which Jacob will get into in just a few minutes. Because of this, we need to always at least consider this as a part of the bigger picture. Lyme is real. For those patients, and I can assure you that the vast, vast, vast majority of patients who come to see me are told that there's no such thing as chronic Lyme disease, and sorry, there is chronic Lyme disease. The CDC admits there is chronic Lyme disease. It can be treated, and it is important for you to get started whenever you can. So we're going to continue with Jacob's presentation of a wide variety of questions, which we'll try to do as best we can. If you need to contact me, I encourage you to look at my website for further information. There's some other lectures that I've given in more detail on this subject. If you have questions for me that are medically oriented, you can go on my website and contact me through that site. If you would like to see me as a patient, you can also make an appointment. And I wanted to point out that Dr. Teitelbaum and I will be hosting a new radio program on Voice America called The Cutting Edge of Health and Wellness Today, beginning August 1st. I would encourage you all to tune into that and listen. And I'd like to also shamelessly plug my newest book, Healing is Possible, which covers all of these things in much more detail and is readily available. So I'd like to thank you all for your attention, and let us move on to Jacob's presentation, and then we can try to answer as many questions as we can.
Thank you, Dr. Nathan. That was incredibly informative, and I'm glad that you took time out of your busy schedule to share that with us. And now I'd like to introduce Dr. Jacob Teitelbaum, the most knowledgeable person I have ever met in my life, or probably will ever meet, about chronic pain, chronic fatigue, fibromyalgia, an incredible integrative physician. And thank you so much, Jacob, for joining us today.
Well, thank you, guys. And Neil, that was awesome. Dr. Nathan is one of my favorite rising stars in the area of CFS and fibromyalgia. And for those of you, again, who have chronic Lyme and who are looking for a good balanced approach and that's really well informed, for going with the antibiotics and the anti-infectious treatments combined with the natural aspects, Dr. Nathan is superb. So he's given the background about the infections, the bugs that do them, and all the things you need to know to scare you to death. So I do want to give a little bit of a perspective that, as Dr. Nathan noted, the Lyme disease is just one of many, 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 many of over 100 causes of things that can trigger chronic fatigue syndrome and fibromyalgia. And for the symptoms that he gave, the only symptoms of that whole list that are not standard and commonly seen in CFS and fibromyalgia would be fevers. Now, anybody can feel feverish with the disease, but actually having temperatures that are going over 99, over 100 with some regularity. The cranial nerve problems, so things like Bell's palsies or vertigo. Dizziness, routine. Instability, routine. Vertigo, I'm going to be thinking Lyme disease. Joint pain and numbness and tingling, most everybody with fibromyalgia, that's routine. But if you have red hot swollen joints, I'm going to be thinking antibiotics. So, the question is, to start, when should you be thinking Lyme versus when should you be thinking that you have fibromyalgia or even fibromyalgia secondary to Lyme? And the simple answer is if you can't sleep. Lyme disease does not cause insomnia except to the degree that it's triggering fibromyalgia. So if you have trouble sleeping, you have secondary fibromyalgia. And remember, any of dozens of infections and dozens of other insults to the body or stresses can trigger the fibromyalgia process. So if you find that you have chronic Lyme and you're getting antibiotic after antibiotic after antibiotic, you're starting to feel a little bit better, but then suddenly it's not working anymore and you're chasing the next strongest and highest dose form of antibiotic. The reason you're not getting better may be not a matter of you need more antibiotics or stronger ones, but that you have to treat the rest of the fibromyalgia process. Basically, this is a post-infectious result in the body. And when you treat this, our gold standard research, double-blind, randomized, placebo-controlled, shows that most people with CFS fibromyalgia pain, and even those with chronic Lyme who have the secondary fibromyalgia, can reclaim their vitality and get free. Now, since most people who have fibromyalgia do not have Lyme disease, most often we can get them better without the antibiotics. But we're not at all averse to using the antibiotics. And again, as Dr. Nathan said, 10 days of antibiotics is like taking a squirt gun to a forest fire. It just not even going to start to address the problem. So some people will need antibiotics for months to years. And if so, that's okay. But if you only give the antibiotics, you will find that you initially get better. And then after about 6 weeks, the candida starts to overgrow and you will go downhill. So you need to treat the whole process. So what are the hallmarks of fibromyalgia? Tired, achy, brain fog, can't sleep. If this sounds like you, you've got fibromyalgia. And as you've seen, this is a common mix of symptoms that occurs after a severe insult to the body, after severe stress. And when you have this and you go to the doctor and the doctor says, I don't know what that combination means, and then they say, I don't know, so you're crazy, which, by the way, is not acceptable. If you have a doctor, if you go and you say, I have these symptoms, and they say, I don't know what's wrong with you, so you're crazy, here's what I want you to do. I want you to look the doctor in the eye and say, thank you, thank you, thank you, thank you. Go over, give him a big hug, tell him again, thank you for letting me know up front what an utter and complete idiot you are, so I don't waste my time on you. Turn around and walk out the door. Simply. That's it. It is not acceptable for the doctor to say, I don't know what's wrong with you. I'm sorry is one thing. I don't know what's wrong with you. I'm crazy. That's abusive and simply not acceptable. So if you have these symptoms, tired, achy, brain fog, can't sleep, we're going to explain to you what's going on, how you're basically blown a fuse, and we're going to teach you how to recover from that. And then we're going to have the Lyme fit into place in perspective as one of the many stresses on the body that can trigger a secondary fibromyalgia. So let's start with the research study we've done. Basically, we did a study where people either got all active or all placebo treatment. Nobody knew who was getting what till after the study. 91% of the people with fibromyalgia and CFS who were in the active group got moderate to marked improvement in their symptoms with the SHINE protocol that we're going to be talking about. This was published in the Journal of Chronic Fatigue Syndrome. So let's take a look at the study. This is the title, Effective Treatment for CFS and Fibromyalgia, Placebo-Controlled Study. It was, again, the gold standard design. The design was put together with the help of researchers at the NIH who are very gracious in helping me design it. And there are 32 people in each group, 32 who got active, 32 who got placebo. And you'll find that of the 32 in the active group, at the end of an average of about 99 days, half of them rated themselves as much better, 13 more as better. So 29 out of 32 felt better with this treatment. 2 had no change, 1 was much worse. And in the placebo group, we'll see the usual bell-shaped curve. So 3 people were much better. And you haven't lived until you've had to tell somebody who's much better that it turned out that they were in the placebo group. And again, you'll see the same thing with cancer and with other illnesses. It does not mean that they're crazy. What it means is this number, the 3 and 9, shows that there's a strong power and ability of the body and the mind to heal itself. And in medicine, we like to call that the placebo effect, because what it says is that your ability to heal yourself, if you think you can get well, you are just crazy to begin with. It's a way of disempowering people, turning them into powerless patients. So we put this pejorative placebo responder. But the mind can help heal from virtually any disease. But you'll see dramatic improvement in the active group, minimal improvement in placebo group. For those of you who like the statistical values, the P was less than 0.0001 versus placebo for all 4 outcome measures in the study. We had a well-being index. 0 was dead, 500 was Superman or Superwoman. The average person started at 170 at the beginning of the study. Minimal change in placebo group, but you'll see this average 75% increase in well-being by 3 months. That went up to 90% at 2 years in the active group. And as many of you have seen, you get one link in the chain stronger, you feel better, but then now this stresses other ones, and then you crash again. And that's why it's so important to do an integrated protocol where you're treating the whole process at once and not just a little piece of the puzzle here or there. And this is one of the things that Neil knows, and Neil does very well. I know what he does goes so way beyond what he was talking about today in the brief time that he had. So in terms of long-term effectiveness, a 2-year follow-up of our study showed that people continue to improve despite being able to wean off of most of the treatments. So there's a lot of treatments in the beginning, but these are like crutches. You use them to help you feel better, and then when you feel better, you throw away the crutches. So the average person, went from an average 75% increase in quality of life at 99 days to an average 90% increase in quality of life at 2 years. So this is very, very effective treatment. Now, so the study conclusion was that effective treatment is now available for CFS and fibromyalgia. And so let's take a look at the symptoms again, because you'll see, as Dr. Nathan noted, these symptoms overlap symptoms of Lyme, mold, space alien attack. I mean, all these different things that people are attributing to. You know, is it fluoride? Is it mercury? Is it my dog looked funny at me? I mean, there's a common set of symptoms. And once you have these symptoms that are poorly understood and experienced by millions of people, you will have people attributing, it seems, every cause in the world. Well, it's being caused by being Mars in retrograde. You know, there's just anything will come up and you go, oh, really? And because if they describe your symptoms. So it's important to understand what the symptoms are, what's going on. So number one, basically think of this illness as an energy crisis where anything has stressed your body to the point where you trip a circuit breaker. It's like blowing a fuse. There's no damage, but that circuit goes offline. And so the symptoms you're going to see, that circuit controls sleep. So you're going to see insomnia. And that's why that combination of can't sleep, even though you're exhausted, that tells you that you tripped a circuit breaker. Muscle and joint aches, well, if muscles don't have enough energy, they get locked in a shortened position. Think of after a hard day's work. People don't go home and say, oh, honey, my muscles are so loose, and, you know, they say they're so tight. When muscles don't have energy, they're like a spring. It takes energy to release a muscle. Without energy, the muscle will contract and shorten. So no energy, we get widespread muscle pain. Chronic muscle pain will trigger nerve pain. Allergies, because the immune system is overwhelmed in these situations. So many of you are going to have many sensitivities to foods, medications, and there's a wonderful treatment. It's an acupressure treatment called NAET. So www.naet.com to find a practitioner. To give an idea, this approach we've found to be so powerfully effective for people that our foundation funded a study using NAET to treat autism. And 23 of the 30 children in the treatment group we're back in regular school at the end of 1 year of the NAT treatments, as opposed to 0 out of 30 in the untreated control group. We've now been funded for a $2 million study of over 1,000 children with autism that will be a randomized, double-blind, placebo-controlled study using the NAT. So if you're interested in being part of the study, contact them at NAT.com. That study is getting ready to launch very soon. Brain fog, and you'll find difficulty with word finding, word substitution. You say fork for knife, or, you call your husband by the neighbor's name. And guys, that's not a Freudian slip. That's a brain fart. That's brain fog. You'll see chronic sinusitis and spastic colon. That comes from the candida. You knock out the candida, sinusitis, and colon problems go away. Frequent infections. Average 32.5-pound weight gain. 2 studies out of our center showed the average weight gain, 32.5 pounds. We'll see 75 to 100 pounds as the metabolism changes in this disease, and 73% will have loss of libido. So these are all very, very common symptoms. The symptoms, though, that should leave you thinking that Lyme clearly needs to be looked at will, again, be vertigo. And let me not say Lyme, but antibiotic-sensitive infections, because I'm still not convinced that the testing we have is worth a damn. Neil has much more experience with the testing. I have enough skepticism that I'd rather listen to the person, look at their body, and make my choice than give the antibiotics, see if they respond, and make my diagnosis that way. But if you have vertigo, as we talked about, if you have Bell's palsy or cranial nerve palsies, inflamed hot joints, not painful, but inflamed hot joints, that's the time to be especially thinking antibiotics. Other things that will leave me giving antibiotics will be if you have a chronic low-grade fever, anything over 98.6. Most people are on a low temperature in this disease. If you have chronic lung congestion, if you have a history of being allergic to numerous antibiotics, that's not allergies, that's a die-off reaction. You're killing something that needs to be killed. Or if you have scabs on your scalp, that often reflects a body-wide infection that responds well to the antibiotic treatments. So again, these symptoms sound a lot like Lyme because they're a common set of symptoms that occur from any of a number of stresses that make you blow a fuse. So again, maybe at the end, Cheryl and Jennifer, I don't know if you can put Dr. Nathan and I both on. Maybe we'll talk about testing in a conversation together if you can do that. So let's take a look at what causes this mix of symptoms that we call CFS, fibromyalgia, chronic Lyme disease, or post-infectious fibromyalgia, which Lyme is one of the dozens of infections that trigger it. Well, we mentioned it's a body-wide energy crisis where you blow a fuse, and that circuit breaker is called the hypothalamus. Things that can trigger it, dozens of infections, hormonal deficiencies, low thyroid, low estrogen, low testosterone, low adrenal, food sensitivities, toxins, nutritional deficiencies, poor digestion, stress, poor sleep. There's literally hundreds of things that can make you blow a fuse. So it can be a toxic chemical, it can be a toxic boss or a toxic spouse. So many different things can do that. So here's a nice picture of the hypothalamus. You want to avoid stresses. So when you see things like that, you go, blam, like that, and you go on to the next slide. But what's important to realize, this disease, can you imagine in your home, if all of a sudden, it was a cold winter night, you had 5 space heaters plugged in, and all of a sudden all the lights went out in the living room. And weeks later, there's still no electricity in the living room. You call 6 electricians, and every one of them, they flip the switches, look at the circuits, they say, everything's fine, there's nothing wrong. And you say, there's no electricity here, duh. And they look at you and flip the switch again and say, we tested it, it's all fine, there's nothing wrong or crazy. And they walk out. The 7th electrician walks in, flips the same switches, looks around, and then says, okay. Walks over to another room and opens up this little panel you'd never seen on the wall and says, see this? This is a circuit box. And see this number 7 is flipped off? And you look at the door, the circuit box door, and you say number 7 controls living room lights and receptacles. And he turns it back on, and the lights come on for about 4 seconds, and then all back off again. So he takes a look around. He says, oh, see these 5 space heaters here plugged in. He unplugs them, turns them on. The lights stay on. And this is an analogy that's really going to explain what's going on in your body, so, and what you've experienced. So as he walks out the door, you say, can this happen again? And he says, absolutely. If you plug in 5 space heaters again, you're going to overload the circuit and you'll blow a fuse. So turning a circuit breaker on in this disease is, back at it, not hard, but it helps to understand. So if you had a little door on your brain and it said the circuit, hypothalamus, and said this circuit controls, it controls sleep, which is why you can't sleep even though you're exhausted. It controls hormone function. So your entire hormone system, thyroid, adrenal, ovaries, testes, offline. It controls temperature, so 98.6 is a fever. And it controls autonomic function. So most of you will tend to have low blood pressure, wide pulses, sweats, bowel function. You're going to tend to sometimes get dizzy when you stand up. You may have POTS and early mediated hypertension. All of these things are controlled with the autonomic function. So that's all in this one circuit. Once you realize that, it explains the mix of symptoms that you have. Because that, combined with the muscles tightening from poor energy, explains most of the symptoms we'll see, and then the immune system goes down. But all of this requires enormous energy. And because of that, the hypothalamus acts as a circuit breaker. It goes offline into hibernation during overwhelming stress. And even though it's really annoying to have the circuit go off and have no electricity, it actually protects, just like a circuit breaker protects your house from burning down in the face of overloading a circuit. This disease acts as a circuit breaker, protecting you from further injury in the face of overwhelming stress. Now, that's all well and good, but if you don't know how to turn the circuit breaker back on, that's not going to be much help. So we're going to teach you how to turn that back on. And as you mentioned, when your muscles don't have energy, they get locked in a shortened position. You think, well, no, it takes energy for muscles to contract. No. Think about the writer's cramp or rigor mortis. Muscles go tight as a board when they don't have enough energy. And when they go tight, they hurt. So stepping back for a moment, even though Lyme is one of many different pieces of this puzzle, it's helpful to understand why you blew a fuse, what it is that tripped your circuit breaker. And the one question that can really help sort it out pretty quickly for many people is the simple question, I ask, when did you blow your fuse? And was it sudden or gradually? And if people say, well, it was like April 17th, 1992, I mean, it's sudden. I'm going to be looking at viral, parasitic, or antibiotic-sensitive infections, including Lyme. I'm going to be looking at injury, like after a car crash or after a pregnancy. If people say, well, I've been feeling lousy for 7 years, but poorly for 10, 12, kind of a gradual onset. You want to look at hormonal and nutritional deficiencies, yeast or candida, autoimmune diseases, lupus, Sjogren's, most autoimmune diseases can trigger fibro. Sleep disorders like sleep apnea, restless legs, and severe stress. So now one simple question will separate out what blew the fuse. Now sometimes you won't know what blew the fuse, and it's not always important to know, but it will give some idea so you don't blow the fuse again. People ask, what's a nice doctor like me doing in a controversial field like CFS and fibro? Well, I got into it the old-fashioned way. I had what I call drop-dead flu or post-viral fatigue in 1975, and it actually knocked me out of medical school. And since I was paying my own way through med school, that meant no work study, no scholarship, no loan. I was actually homeless, sleeping in parks after I had to drop out. And it's as if the universe hung a holistic homeless medical school sign on my park bench. Doctors came by, herbalists came by, acupuncturists, naturopaths, all these different folks, and they each taught me pieces of the puzzle. Taking that information, I was able to piece together a regimen to get myself well, and a year later was able to return to medical school. So basically, when people say, how do you know how that feels? How do you describe it so clearly? It's like, been there, done that. And again, you can get well from this disease. I'm walking proof of that. So let's go forward. You blew a fuse, and to turn the circuit breaker back on and make your fatigue go away, there's 5 main areas that need to be treated. So this is kind of a general overview and checklist that will help organize this for you. And you want to think SHINE, S-H-I-N-E. S stands for sleep, H is hormonal support, I is infections, nutritional support, and exercise as able. Now again, I'm going to say as able because if you try to do too much, you're going to crash and burn. And then you're going to be afraid to do anything, and then you'll decondition, which is just as bad. So go for walks as you comfortably can. When you treat with this mix of processes, our research shows 91% of you will get better. And that's pretty good odds. So we're going to go through a lot of things today. To simplify it, we have a free symptom analysis. It's basically called the Energy Analysis Program at the www.nfatigue.com. My new patient visits are 3 to 4 hours, and I realized quickly that I was not going to be able to treat 50 million people on the planet one-on-one. So what I did is I made a computerized program. It's kind of like a computerized doctor of sorts. I actually hold a U.S. patent for a computerized doctor that we made to help people with CFS and fibro. This program, however, what it does is it will analyze energy and what's draining your energy and how to optimize your specific energy. So it's the Energy Analysis Program. It'll take you through a series of quizzes. You don't need to have lab tests available, but if you do, it will analyze the pertinent lab tests as well. And it will put together a very detailed and thorough regimen using a mix of both natural and medications treatments to help optimize energy. And optimizing energy is a key part of getting your life back here. So, question, is it just Lyme disease? Well, if you have insomnia despite being exhausted, you also have chronic fatigue syndrome or fibromyalgia. It's that simple. And if this was an audience where everybody could see each other, I'd say how many of you who have this disease also have trouble sleeping unless you take something? And you'd find that about 90 to 95% of you would probably raise your hand and go yes. So it's really critical to treat the secondary CFS and fibromyalgia. So as we noted earlier, when will I add antibiotics to the SHINE protocol? If you have low-grade fevers, again, anything over 98.6 with any frequency, red-hot joints, vertigo. Vertigo is when you're spinning around in a circle where you can actually tell whether it's you or the room that's spinning around. And I'm not talking about lightheadedness or disequilibrium, which everybody with it, most people with the disease have. If you have nerve palsies like Bell's palsy, chronic lung congestion, scalp scabs, allergies to multiple unrelated antibiotics. You know, people come in, they say, oh yeah, I'm allergic to penicillin, erythromycin, tetracycline, anything else? Oh no. And the odds of being allergic to 3 chemically unrelated antibiotics and nothing else boggle the mind. When you have that, that's a Herxheimer reaction. You have an infection that needs treated. So that gets very, very straightforward. So in these cases, I will add the antibiotics. I'll give them, sometimes I'll give just 6 weeks. And because in some people that's enough, and that seems to knock out what the process is. I may not be Lyme and maybe other things. But most cases, if they're feeling better with it, then I'm going to continue it for the 6 months and then continue to repeat courses as needed based on a clinical response and how they feel. So let's take a look at SHINE. And let's start with N, which will be a nutritional, look at the how to optimize nutrition easily. I like something called the Energy Revitalization System. It's a vitamin powder. It has 50 key nutrients in it all in one drink. It replaces over 35 pills. And for those of you who say, yeah, right, 35 pills, I'll throw out this challenge. If you can get what's in that one scoop and the one drink in less than 35 pills, I'll give you $100. Nobody's been able to do it. Most people find it takes 50 to 60 pills to get what's in one drink. So that one drink is going to have 50 key nutrients, including malic acid and other energy cofactors, inositol, amino acids, vitamins with a high-dose B complex, minerals. It's going to have everything from A to Z that you should have gotten from your diet, except for calories and proteins. You still have 7 grams of proteins, with the exception of iron and essential fatty acids and enzymes. Otherwise, all the vitamins, minerals, other things that you should have gotten from the diet will pretty much be in the vitamin powder at optimal amounts. Other key nutritional things: increase your water intake and decrease sugar. You want to avoid sugar. Sugar really drives the illness crazy. And you are going to be dehydrated. Now, you're saying that, oh, well, I drink 4 times as much as my husband drinks, and say, yes, you do. But you're peeing 5 times as much. One of the hormones as low as antidiuretic hormone. You need to increase salt. If you salt restrict with chronic fatigue syndrome and fibromyalgia, you will crash and burn. Get a good quality sea salt. Eat more salt, unless you have high blood pressure, in which case look for sleep apnea. Most people do better with a high-protein, low-carb diet, but everybody's different. See which one feels best to you. And then for 3 to 9 months, there's special energy nutrients. These are not nutritional deficiencies that come from the diet. These are increased losses because of the disease. So these are not in the vitamin powder. You need to take these separately. Acetylcarnitine, 1,000 milligrams a day for about 4 months. Ribose. Ribose is an amazing energy nutrient. 5 grams 3 times a day for 6 weeks, and then twice a day. Coenzyme Q10, 200 milligrams a day. Take it with some oil or some food so you absorb it. And for fish oil is really important and helpful, but there are now vectorized forms of the fish oil where 1 pill replaces 8 regular honker fish oil pills without the fish oil burps. Much lower cost, much easier. This is what I take each morning. I do the vitamin powder, I do the ribose or CoQ10, and one of these fish oil tabs, one of the essential fatty acid tabs, I should say, which is a remarkable one. Let's take a look at ribose. Ribose is a key energy nutrient made by the body. Our energy molecules, if you eat a hamburger or a soy burger, your body has to turn that into ATP and other energy molecules so you can use the energy. They can't just burn the food directly. These molecules are made of ribose, adenine, and phosphate, plus B vitamins. So if you look also at DNA and RNA, ribose is key. Deoxyribose nucleic acid, ribose nucleic acid. So we were wondering whether ribose deficiency was playing a role in CFS and fibro. We knew that giving B vitamins and magnesium was very helpful. But we went ahead then and did an initial ribose study with 41 people with CFS and fibro. We gave them ribose for 3 weeks. 2/3 got better with an average 45% increase in energy. And we said, wow, usually if we see a 10% energy increase in a study of a single nutrient, that's major. So we did a larger study of 257 people with CFS and fibro. This is 53 different health clinics. And the improvement was amazing. We gave them the ribose, 5 grams 3 times a day for 3 weeks. And the average improvement in energy, after 3 weeks, 61% increase in energy. I want you to take a moment and just picture what that would feel like. What would it feel like to have 61% more energy? So the ribose or corvalin, I recommend that for anybody with CFS, fiber, or anybody with fatigue. I take 1 scoop each morning myself. But again, after 3 weeks, you can drop it down. After 3 to 6 weeks, you can drop it down to twice a day. And the one thing is if you have low adrenal, sometimes you'll feel you get hyper or over-energized from the ribose, in which case we'll talk about adrenal in a moment. So anybody with CFS, pain, fatigue, or heart conditions, I'm going to give them ribose. It comes as a powder that looks and tastes like a sugar. You'll see the effects by 1 280-gram container by 3 weeks, often within days. Take it with a vitamin powder. Sometimes you'll see over-energizing, treat the adrenal, or lower the dose. So this is a really remarkable nutrient. Now, let's take a look. We talked about the N in shine, which is nutrition. Let's go back to S, which is sleep, because it's critical that you get a good night's sleep. People with CFS and fibro have trouble falling asleep and also staying in deep sleep. So I like to begin with natural sleep support. There's a nice mix called the Revitalizing Sleep Formula that has 6 herbs, passion flower, wild lettuce, Jamaican dogwood, valerian, hops, theanine. All of these 6 together, for most people with day-to-day insomnia, that'll leave most people sleeping like puppies. But people with fibro, because the sleep center is not working, you're going to need much more. You can add in other things like calcium, magnesium at bedtime, melatonin, 0.5 milligram. 5-HTP is very good, 200, 300 milligrams. But if you're taking anything else that raises serotonin, like an antidepressant, you want to be careful with that because it can raise it too high. Lavender is very good. The smell of lavender oil, there's a form called Calmade. Any of these things can be very, very good at helping sleep. Just put a drop of lavender oil on your upper lip right below your nose before you go to bed. Keep the bedroom cool. And in wintertime, don't forget a good old-fashioned hot bath. Take 1 or 2 cups of Epsom salts, which are magnesium salts. Throw them in a tub of hot water. Throw in a little bit of lavender oil. Pour yourself a glass of red wine, unless you have candida and your body doesn't tolerate alcohol. Get yourself some of the most delicious chocolate you can. Get a small square, light some candles, and soak. And then after the bath, take a half hour to cool down, wrap up, in a robe, and then go to sleep. You'll find your sleep will be much, much deeper. I will use a mix of medications, but picking medications that maintain deep sleep. Most sleeping pills worsen deep sleep. Let's take a look at the hormones. These are your body's communication systems. They're glands that put out chemicals called hormones that send messages throughout your body. And this is controlled by the hypothalamus. That's the circuit that's offline. This includes your body's gas pedal, the thyroid, your stress handler, the adrenal, and your ovaries and testes. So the hormone systems across the board are functioning poorly. And even mild deficiencies, and you will have deficiencies despite normal blood tests, will leave you feeling miserable. And you always, always, always want to treat with the bioidentical hormones. The main reason for using non-bioidentical hormones is that you can't patent a natural hormone. You can patent the synthetic chemicals, and therefore they become profitable. But beyond that, it's been slick marketing convincing doctors that poison is good for people. You want to use the bioidenticals. So let's take a look at thyroid. How do you know if you need thyroid? 1, tired, achy, weight gain, cold intolerant, loss of the outer thirds of your eyebrows, poor memory, depression. Does this sound like you? If you have 2 or 3 of these, you deserve a trial of natural thyroid by prescription. And I'll use the Armor Thyroid or Nature Thyroid. Although everybody's different. We could do a 3-hour talk just on different types of thyroid hormone and how to adjust it for each person. But the bottom line is the tests are awful. They're horribly unreliable. You are better, let's see, what's more likely to be reliable, a magic 8-ball or the TSH test? Scary. The magic 8-ball, which is totally random, is more likely to be reliable in diagnosing hypothyroidism than the TSH test. So the test is that awful. As people know me as a master of subtlety, I'm not big on it. The test sucks, sorry. Anyway, weight gain. Average weight gain is 32 pounds, as we noted. You can promote weight loss by treating the thyroid and adrenal problems. The acetylcarnitine does not cause weight loss, but it will allow weight loss. Treat the fungal overgrowth. The candida causes sugar cravings and seems to cause weight gain for other reasons. If you don't sleep, you will gain weight, shown in many, many studies, and treat the insulin resistance. Once these things are done, then people often find they can lose weight. Let's take a look at the adrenal. People get adrenal burnout. These are these little glands sitting on top of the kidneys. These are the stress handlers. So chronic stress of any kind can exhaust the adrenals, but also the circuit breaker being off, which controls the adrenals, will cause them to underfunction as well. The blood tests for adrenal problems, unlike the thyroid test that misses low thyroid the majority of the time, the adrenal tests let's take a moment to talk about what normal range means on a blood test. All the normal range means for most tests is based on what's called two standard deviations. They take 100 people, the highest and lowest 2.5% are defined as abnormal, and the 95 in the middle of the normal range. And an analogy that I like that I gave to Dr. Oz that he likes to run with is using shoe sizes. And if I wanted a normal range for shoe sizes, I'd sit at the mall, take 100 people who came by, and I'd get a normal range of 3 to 13 for shoe sizes. Now, I live in Hawaii. We live on an active volcano. We don't want to track lava in, so people leave their shoes at the door. So say my wife and I went somewhere, and then we got our shoes mixed up, and now I'm wearing her size 8, and she's wearing my size 13. And we go to the shoe doctor. And the shoe doctor says, no, honey, it's a size 13. It's in the normal range. There's nothing wrong with the shoe. You know, and he looks at me and says, no, Jacob, it's a size 8. That's smack dab in the normal range. And I say, my toe can't even get in this shoe because I have a size 13 that I wear. And he says, it's in the normal range. You're crazy. The test is fine. That's an exact analogy to what's going on with thyroid testing. Now, for the adrenal, you don't have to be in the lowest 2 out of 100 to be abnormal. For that test, you have to be in the lowest 1 out of 100,000. Everybody else is considered fine. So most people have a cortisol level of about 20 in the morning. Anything over 6 is normal. Under 6 is considered life-threatening. 6.1 is totally fine. If I do 2 cortisol levels on the same person, same blood draw, same tube of blood, they routinely will be 4 to 8 points apart. But 5.9 can kill you and 6.1 is normal. How do you spell insane? But anyway, that's the way it's done in medicine. So how do you tell if you have low adrenal? Well, I have a very high-tech way. When people come in, or if I do a phone consult, they're often with their spouse or a friend, I ask, are there periods where it's like a light switch goes off and you've got 3 minutes to feed them or they will kill you? And if they both nod their head up and down and go, how did you know? It's been spying on us? That's low adrenal, and I will give adrenal support. Crashing with stress, frequent infections, low blood pressure, these are all symptoms. But the key one is irritable when hungry. You'll find people in divorce lawyers' offices and marriage counselors because when they get hungry, sugar drops and their claws come out. You'll find often treating the adrenal will often take care of the marital problems as well. So how do I treat adrenal? I'll give a mix of adrenal extracts, vitamin C, vitamin B5, and licorice. Not hard. Then I'll also increase salt and water intake. And if the DHEA is low, I'll give DHEA, and I'll consider bioidentical natural cortisol in ultra-low dosing. Infections, again, I will treat everybody with CFS and fibromyalgia for presumptive yeast or candida overgrowth. The symptoms, in addition to all the other symptoms of CFS and fibro, include sinusitis and spastic colon. These are symptoms of candida, and when you treat these, they will often go away. I'll give probiotics, a low-sugar diet. I'll use stevia. The one that I like is called Body Ecology. I can get a 1-800-4-STEVIA. I'll give natural antifungals, and I will give the medication Diflucan, 200 milligrams a day for 6 to 12 weeks. At that point, it's also important to look for and treat other infections. We talked about things to make me think about antibiotic-sensitive infections. I will look for parasites at a lab that knows how to do parasites. Most do not. There are other criteria that will make me think of treating a viral infection, antibiotic sensitives, and I'll use immune stimulants, maitake mushrooms, ProBoost, a host of good natural immune boosters. A very important one is zinc, 20 milligrams a day for 4 months. Zinc deficiency will be routinely found in CFS and fibro because chronic infections or inflammation cause zinc losses, and then that causes immune dysfunction. So that's the most effective nickel a day you will spend on improving immunity. So things like ProBoost are $3 a day, and the zinc is 5 cents. So all of them are good. But the funny thing in medicine, what something costs has nothing to do with its effectiveness. Zip. So chronic infections, we talked about some. Many viral infections, EBV, CMV, HHV6, Lyme, Mycoplasma, Chlamydia, Bartonella, yeast parasites. So Lyme, to put it in perspective, is one of many, 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 many triggers. And again, even though and Dr. Nathan is much more knowledgeable on Lyme than I am. I'm still not at the point where I trust any of the tests for Lyme disease. I don't trust the IGeneX tests. He does. He's probably right, but I still, I'm not comfortable yet with any of the tests being reliable. So let's wrap up a little bit with the mind-body connection, because all illnesses, whether it's cancer, MS, if you look at uterine cancer, for example, associated with a hopeless, helpless personality. Multiple sclerosis tends to be associated with repressed rage. That's why people with MS are some of the sweetest people you'll ever know. Heart attacks associated with hostility. So that doesn't mean if somebody comes in with crushing chest pain and a heart attack that you say, okay, we're going to meditate now, relax, blah, blah. You take them, put them on the coronary intensive care unit, you treat them, then you treat the psychodynamic. In CFS, think about it. CFS and fibromyalgia represent an energy crisis. What kind of psychodynamic would make it like you have a hole in the bottom of your energy bucket? Well, picture this. Try this on for size. Low self-esteem as a child, being an overachiever, trying to be all things to all people to get approval because you may have felt inadequate, not being able to say no, being a mega type A overachiever, and it's usually not the valedictorian in the class who gets it. It's the salutatorian, the second. And then taking care of everybody except who? Who's the one person you don't take care of? Yourself. So not being able to say no, and many of you are going to find that you tend to be empathic and that you draw what I call energy vampires. And you know those folks who, you know, on those days that you feel like you're suddenly a little bit better, a little more energy, it's like a big neon sign goes on over your head that says emotional toxic waste dump open. And all of a sudden, it's like they have, you know, ESP, they know, and in they come, and first they put in their hooks. Oh, if not for you, I don't know what I'd do, hook. Nobody cares, nobody listens, hook. I'd be dead without you, hook. And they put all those in. And then after they put the hooks in, then they back up and they start to regurgitate all of this emotional garbage all over you. And literally, it's like throwing it up all over you. And then they say, oh, I feel so much better now, thank you. And then they suck you dry. And you feel like you're sucked dry, and they go away saying, I feel so much better. Any of you know people like that in your life? Well, the antidote is when it feels bad. You'll know that it feels bad when you see them coming. You learn to say the word, the magic word, no. And no is a remarkable word. It's funny. It's a very versatile word. It's a complete sentence. There's this great T-shirt, what part of no didn't you understand? So simple rule of thumb, doctor giving you this recommendation. If somebody asks you to do something and it doesn't feel good, what are you going to say? No. And if they start laying a bunch of, but if not, no. And if they still lay stuff on you, you say, well, my doctor said that he'd wring me, my neck if I said yes to any of this stuff. And if they still say to do it despite your doctors telling you not to, then you say, you want me to do something, my doctor's making me sick? Who the hell are you? Get out of my face. Whatever it takes, no. Other people ask, should they get counseling? And the answer is, if you feel like it, just like any other severe disease. If somebody with cancer says, should I get counseling? I ask them, well, do you feel like you need it? You know, do you need help in coping? If they say, yeah, they say, get it. If they say no, they say, don't bother. And this is no different. It's the same thing here. But you want to be careful. People tend to go into what they have. I had chronic fatigue syndrome. My cardiology friends has heart disease. And my gastroenterologist friends were lactose intolerant. And my psychiatry friends are neurotic. And some of them do really good work, inner work, and come out being really solid people. And others are just projecting their stuff all over the place. So when you go for counseling, you want to make sure that psychoanalyst is one word and not two. And you'll know by how it feels. If it feels awful, maybe the hardest thing you've ever done, but if your gut keeps going, run. Talk about it with them. If it still keeps going, run. Do so. There are many other CAM therapies that can be very helpful. We've talked about the metabolic aspects of therapy today, but there's massage, acupuncture, chiropractic. Now, CBT, cognitive behavioral therapy, has been caught up in controversy. Why? Because unlike what true CBT is, which simply teaches people how to have coping skills with any illness and can be very helpful, the CBT in England has been a political movement that basically, when some people, includes convincing the person that there's nothing wrong with them and they're crazy, and then passing laws to make it illegal for them to get the care they need. That's not CBT. That's terrorism. And that's totally unacceptable. But if you go to somebody, if you go to a cognitive therapist and say, do you believe fibromyalgia is a real disease? Just like to believe cancer is a real disease. And if they go no, say thank you, click, call somebody else. But if in good hands and somebody who's giving you coping skills, it can be helpful despite the bad rap it's gotten. But if a person's trying to make you believe that there's nothing wrong with you, you're crazy, remember what I said before, give them a hug, smile at them, say thank you for letting me know you're an idiot, leave. And then NAT for allergies, EFT, emotional freedom technique. Wonderful way to clear old traumas, whether it's been assaults or emotional abuse or physical abuse or any of a number of traumas. If you go to EFT.mercola.com, you can actually see it, and I'll show you how you can do it on yourself. It's a remarkable tool. So let's look briefly at pain. Pain is not the enemy. Pain is like the oil light on your dashboard saying that something needs attention. If you put oil in the car, the oil light goes out. If you give your body what it's asking for, the pain light goes off. Shine in our study knocked the pain down 50%. But if you want a pain relief miracle, there's a mix of PCM95 curcumin, DLPA, nattokinase, and boswellia, which has been more effective in many people than even codeine. It's a really remarkable herbal mix for pain. A couple shameless plugs. My book, From Fatigue to Fantastic, which has been the #1 best-selling book of all time on CFS and fibromyalgia. It's like a textbook for those of you who want details, over 500 study references. If you want it easy, my newest book, The Fatigue and Fibromyalgia Solution, is more like reading Vogue or Red Book. It's a nice, simple, fun, short, easy read, but it'll give you all the information you need to get well. But it does it in a nice, easy-to-read manner. A lot of people, I recommend people start with the Fatigue and Fibromyalgia Solution and then move to From Fatigue to Fantastic if they want more information. So the bottom line is that chronic Lyme, which is often fibromyalgia, and fibromyalgia from any cause, are now very, very, very treatable. So that's really, really good news. But the Lyme is just one piece of a large puzzle. If you just give antibiotics, you'll feel better initially, but then get worse from the candida. So the antibiotics can get rid of what triggered you to blow a fuse, but then you need shine to turn the circuit breaker back on. So I want to thank you all for coming, and Dr. Nathan also, he is awesome, awesome, awesome. And I note for those who'd like an appointment, I treat people from all over the world. I do by phone consultations or in person. The phone number is 410-573-5389. Also, my website, endfatigue.com, for more information. Also, we have a supplement shop there, and the energy analysis program is available there, and that's free. And to find a health practitioner, we have a list of practitioners who have been trained by me in treating this disease. We have a free email newsletter and a whole lot more. So I want to thank everybody for coming, and I'm going to pass it back over to Cheryl.
Thank you so much. I really appreciated that, and I always enjoy everything that you share with us. So thank you again. We have just a lot of questions, and Dr. Nathan, you're unmuted as well. So the 3 live phones on here are myself, Dr. Teitelbaum, Dr. Nathan. You have really been busy, so you've answered a lot of the questions. Thank you very much via the chat and the QA boxes. There are several questions, so I'm going to try to sort through here. Well, first I want to say we've had many questions. Is this recorded? Yes, it's recorded, and it'll be available for rebroadcast on the website probably on Friday, no later than Monday. So if you would like to listen again, or if you have friends that you think would benefit from hearing more about the diagnosis of and the treatment of Lyme's disease, please feel free to give them that link. Additionally, we've had several people said that they did not get the handouts. Sometimes they get caught in spam filters. It's a very large handout this time because it's a 2-hour presentation that will come in 2 separate emails, and our webinar producer, Jennifer Hansgate, will re-email those out again tomorrow when she notifies you of the link going live for rebroadcast of this presentation. And then I also want to say thank you back at so many people who have said such kind things about both of you, Dr. Teitelbaum and Dr. Nathan. Thank you so. We've had several that have said thank you so much for the information. This makes me think about things in ways I never have. So we appreciate all of you taking time out of your busy day to learn more. So let's start with some of the questions. And one is, how do you test for mold to see if you have mold toxicity?
Neil?
Yeah, is that mine as a question?
Yep.
Okay. Here we go. Jacob, by the way, always a pleasure hanging out with you on this. I wanted to address one point that you made just for participants so they can understand it a little bit better. The longer I do this work, the more sure it is that I know less and less about it. And what I mean by that more specifically is that when Lyme infects the body, its major issue to the body is that it's an immune dysregulator. And what that really means is that every bug that you ever had in your life, every virus, every minor infection that never completely got eradicated, you are now at large for that opportunistic infection. So although Jacob and I are not in complete agreement about the length of antibiotic treatment, I do agree that we are not always sure what we are treating. So when I'm using an antibiotic, is that killing the Lyme? Is it killing the Bartonella? Is it killing Mycoplasma? Is it killing Chlamydia pneumonia? All of which are very common opportunistic components. I don't think I know. What I do know is that prolonged antibiotic use has helped a large number of patients. Do I know with precision what I'm treating? I think the longer we do this, the less we can say that we do. So I think that would put our comments a little bit more together, Jacob.
Yeah, and I think it's a wisdom thing. That as you recognize that we know less and less, that's a sign you're getting more and more wise.
Oh, you have no idea how bright I am now. Anyway, mold question. I know we didn't get into it, but I want to distinguish mold infection from mold allergy from mold toxicity. The concept of mold toxicity is fairly new in medicine. It was put on the map by our colleague Richie Shoemaker back in 2005 with the publication of his book, Mold Warriors. And Richie put together a brilliant cascade of the biochemical process by which mold toxin does all the things that Jacob just talked about in excellent detail. For those of you, well, there was a question from a participant, like what is the mechanism by which this happens? Richie has laid that out quite nicely. One of the newer things that I have found particularly helpful is that there is a relatively new test from the real-time laboratory called the mycotoxin test. It's a urine test in which we can measure the 3 main mold toxins directly and quantitate them. This is revolutionizing our understanding of the role that mold plays. I would like to refer to a paper published by Joe Brewer about a year ago in which he showed that of 112 patients with chronic fatigue, 93% were loaded with mold toxin, and that by treating them, particularly in some of our patients who have not responded as well as we liked to our treatment program, we're able to help many of them. And I have found that Joe's protocol and his insights particularly helpful. One of the biggest new pieces of information that Dr. Brewer came up with is that many of the patients that he was treating do not currently live in a moldy environment. They are long gone 3 years ago, 5 years ago, 10, 15, 20. And that Dr. Brewer reasoned that for those patients, at some point, the mold had gotten a toehold in that body, meaning it had colonized in particularly the sinus and intestinal area, and that treating those areas along with specifically giving binders that pull specific mold species out of the system was a uniquely effective treatment protocol. So that's kind of my current state of the art about what I'm finding particularly exciting in terms of newer information that I think that our participants might want to know about in terms of mold as a player here.
So are there actual tests that detect these mold toxins?
Yes. What I referred to as the real-time laboratory offers a urine test in which you can just submit a urine specimen and get it looked at.
Neil, what percent of your people that you checked would you find come back positive, rough guess?
Unfortunately, the people I see are, like you, Jacob, kind of the sickest of the sick. Both of us get the old days, Jacob, when we used to, forgive my use of the term, I'm sure it'll come back to haunt me, we cherry-picked the not-so-sick patients and they all got well. That doesn't happen so much anymore. We're getting everyone else's failures now, and it takes more work and more brain power to dissect it and tease it apart and figure out what's going on. So in that patient population, the vast majority are turning out to be mold toxic.
So here's a question that I'd have, Neil, because okay. I'm still a bit of a skeptic with the test, not a cynic, but a skeptic. So what percent, I'd be curious if you took 20 healthy people and did that test, what percent of them would come out being positive? People who live in different environments and homes than the ones you're testing. Because what I'll see with a lot of these things is that, yes, 90% are positive, but 90% of everybody else walking the street are positive, meaning that the real predictive, let's just say the specificity of the test, to be technical, in medical terms, sucks. And so, have you, I don't know if you've had a chance to check the test, it's probably a bit pricey, but I'd be curious if that test was done on a bunch of healthy people, what percent would come back positive?
Unfortunately, I haven't. It is pricey. It's a $700 test. So most of my weller patients aren't particularly eager to spend $700 on what they do or don't have here. So I don't have that data. The laboratory does. The pathologist who runs the lab is Dennis Hooper. And Dr. Hooper has done some of that data. I've looked at his data, and lots of people who are supposedly well have negative tests. I have not had a single well person do it, so I can't address it, and I appreciate your skepticism. I think what I would say, Jacob, is the bottom line for me, and I know it is for you also, is that, a test is a piece of paper. Does a real live person who has been sick for a long time respond to this treatment in a way where you go, that worked? Because our patients are not placebo-driven. They've tried everything in the world, and they're really pretty sophisticated about, that doesn't work. So they're not prone to reacting beautifully to every new thing I throw at them. They're in the state of, like that'll do something. Might even be anti-placebo, if you will. So when I have patients who have been sick for a long time, and I have quite a few of them at this point, who are responding to mold treatment for the first time based on their testing, and I am seeing clinical response correlating with their lab results, I know that it is a good test. Is it a perfect test? It is not. There are 84 known toxic mold mycotoxins, and this only tests for 3 of them. So is it
the bottom line is, I agree. If the test predicts that people are going to respond to treatment and get better, then I don't care about the rest, and that's the bottom line. So how are you treating? How are you treating for the mycotoxins?
Well, there's a threefold treatment program. One, if I identify an excessive amount of toxin, first, I want to know, are you living in a toxic environment? So I want them to test their home. That can be done in a variety of ways. You can have an environmental engineer look at it. The cheapest way, which I tend to use first, is to give them mold plates, which are just Petri dishes that grow mold. I have them open the plate in the rooms that they want to test, leave them out for an hour or two, cover the plate back on and see if something grows. If the plate looks ugly in 3 days, I have them analyzed by the lab. About 50% of the species that grow on those plates are not human toxic, so they don't matter. But if they grow penicillium or aspergillus or stachybotrys or fusarium, then to me that means, yeah, we might want to have this house looked at more carefully. That's step one. Step two, you want to treat them with the binders that are specific for that mold toxin, to be more specific about that. When Richie Shoemaker first started talking about treating mold, he used exclusively cholestyramine and Welchol as his binders, and Richie always insisted that that's the only thing that was worth a hoot. It turns out that that is true for ochratoxin, which is one of the main toxins that we look at this test, but not quite as true for aflatoxin and trichothecene, which are the two other main toxins. So I use the test to help me figure out what binders I want to use. So depending on which toxin we see, I may use chlorella, activated charcoal, or bentonite clay specifically for trichothecene or aflatoxin, and I will prefer cholestyramine for the ochratoxin. Third, once I get them really laid out on a binder that works, then I will add a specific nasal treatment, and I am pretty much following Dr. Brewer's protocol. He uses compounded amphotericin B and an EDTA binder intranasally to treat the sinus area, and he uses Sporanox and EDTA orally to treat the gut. And for our participants, when we're treating mold, it's important to know that mold makes a great deal of biofilm, which is kind of a polysaccharide glop that surrounds the mold and protects it from either your immune system or from anything we want to kill it with. So we have learned that you need to use biofilm dissolving agents with the antifungal materials for it to work properly. So that's kind of a quick summary of what we're doing these days.
Now, two quick biofilm dissolving agents. One, these are like the walls that surround cities that protect them from invasion. They protect the bacteria and fungus. Silver breaks down biofilms, but also bismuth, good old Pepto-Bismol, which you can get at the local supermarket, also dissolves biofilms. That's one of the reasons Pepto-Bismol works. So, again, it doesn't necessarily take high-tech stuff to go ahead and kill these buggers.
I wasn't getting comprehensive about my answer. We use colloidal silver both as an intranasal spray and orally to do exactly that, so I'm in complete agreement with you.
Yeah, let me know, again, there's so much information. Jill and I could go on for hours and hours, except that we can't right now, but we do have a radio show. well, for today. But we do have the radio show. For those that are interested, Neil, would you want to tell people how they can find us come August 1st? Because we'll be having these conversations weekly.
Yeah, absolutely. I'm delighted that Jacob and I will get together to babble at you at length on the topic. Well, we've been at this for a long time, and one of my concerns is that there's a tremendous amount of misinformation on the web, on the net, on the air. Not that we are the be-all, end-all answer, or we are not the oracle of truth. That's not the case. But we both carry a great deal of experience in alternative treatments, and my hope was that we could be a source of information for folks on a regular basis. So Voice America is a nationally and internationally syndicated radio program that came to us and said, would you guys want to do a weekly talk show? So as of August 1st, 2 o'clock in the afternoon on Voice America, I would invite everyone to come join us. We're going to talk about pretty much everything holistic under the sun. First run will be 13 weeks, but my fantasy is that we will go on for a very long time, trying to share with you what we think is the cutting edge of medicine. And so the radio program is simply called The Cutting Edge of Health and Wellness Today.
And what time and time zone again?
In the Pacific Standard Time, it's 2 p.m. to 3 p.m.
Cool. And so that'll be 5 p.m. on Eastern Time. Okay, and that's every Friday?
Every Friday, starting August 1st.
Awesome. Join us.
Absolutely. Please do. So,
okay, then.
Sorry, Jennifer, for that very, very long answer to that question.
That's okay. We have another question here, and I know that you've answered some of these during the chat sessions. So if I ask you something you've already answered, please forgive me. But we do have one quick question for both of you. Do you always have to use antibiotics, or can you use supplements instead?
Okay.
I'll use antibiotics probably in about 5 to 10% of the people that I treat. And I'll use antivirals probably in about a similar percent, and most of the rest. Just stimulating the immune system and having their body heal up with the rest of the showering protocol seems enough to go ahead and knock out the infections. The one exception is Candida because it's so big. If a virus was like the size of a period at the end of a sentence, the Candida would be as big as a whole city block. I mean, these are massive organisms. So I will give diflucan for 6 to 12 weeks to virtually everybody with CFS and fibro. But otherwise, my goal is to get your own immune system working better and stronger because it knows how to then go after all these other infections.
Excellent.
And my comment would be a little different because I don't think that Jacob and I necessarily have the same patient population. I have a much higher Lyme population than he does. When I was treating mostly, I will call it pure chronic fatigue and fibromyalgia, which is a silly term, but I'm going to use it anyway, I would agree with Jacob's answer. At this point, because people come to me as a Lyme specialist, it's a much, much bigger part of my practice. And so let me comment on it from that perspective. For the garden variety, if there is such a creature, chronic fatigue and fibromyalgia patient, I agree with Jacob. For the Lyme patient, in my experience, it is a very, very rare patient who can get well without prolonged use of antibiotics. I would say maybe 1 in 200 patients can get by solely with herbs, Rife machines, homeopathics, and every other treatment that you want to apply to it. The vast majority of my patients need to be on antibiotics for long periods of time, and I say that as someone who is a well-known, I hope, as a very holistic person and have been for 40 years. So for those of you who say, well, that doesn't sound very holistic to me, you're absolutely right. It's of great concern to use antibiotics for that period of time. And the way I put it to my patients are, do I love giving antibiotics for a year or two or more? Absolutely not. But the alternative, which is to have a seriously debilitating disease like Lyme disease go untreated, scares me more. And that's kind of the point.
Yes. How do you cover for Candida overgrowth during the prolonged treatment?
Well, perfect. We do see Candida overgrowth often, not routinely, but often. And I will use, as you had mentioned, regular use of diflucan. I will often have them take 150 milligrams of diflucan once a week on a regular basis. I may have them taking nystatin orally during that time, and I use lots of probiotics in different combinations. So it is critical to cover their gut and take care of it during this period of time.
And one other thing I'd like to mention, too, is that what's critical is also to get the infections in the nose, not just the fungal infections, but also the staph organisms that are often toxin-producing. I think both Neil and I will use a nose spray that has antibacterial, antifungal, and also biofilm disrupting things, and we'll use that for 1 to 3 months. So we didn't talk about it much today. Neil touched on it briefly, but it's a really, really important part of the regimen that's simple, benign, topical, and helps a lot with folks. So it should not be overlooked.
Yeah, I complete agreement with Jacob's comment. Again, we're touching on different things. I never perceived this to be the be-all comprehensive way to treat all of these infections in one simple lesson. I was hoping more to introduce the audience to primarily the important concept is to think about all of these complicated issues. And I'm pretty sure, Jacob, that you would agree that this is fibromyalgia and chronic fatigue is not something that you can treat with Lyrica and it'll go away and be cured. I know that the pharmaceutical industry would love that to be the case. Could Lyrica be helpful? Absolutely. But it is about teasing apart, as both of us are talking about, teasing apart the causes with as much precision as we can bring to the table so that we are addressing the adrenal, the thyroid, the hormonal deficiencies, magnesium, electrolyte, all of these things need to be looked at. And you want to find a medical practitioner who is knowledgeable about this, because otherwise you're only going to get a teeny piece of it. And if you only get a teeny piece of it, you're going to get discouraged.
Well, thank you both. And I do want to squeeze in a couple more questions because we have an awful lot in the queue. So if we could have your quick thoughts on a person who, I'm not going to read through her whole symptom list, but she's been struggling for 40 years. Finally, they think it's Lyme's disease. Is there any hope for treatment and getting better if you've had Lyme's disease for 40 years?
Let me make a simple statement. In the study that we had done, we had people who had been sick for longer than that. And one of the things that our study showed is that how long the person had been sick, how long ago they blew a fuse or tripped a circuit breaker had no impact on their likelihood of recovery. Just like if you trip a circuit breaker 40 years ago and you go in and blow the dust off the box and you turn it back on, all the lights come back on. So in our experience, what I'm going to say is that there absolutely is hope. Neil, from a Lyme perspective?
Yeah, absolutely. You know, if it's not treated adequately, it smolders. It doesn't go away if you don't treat it. I'm a great believer that God cures and I just work here. So there's always hope. I'm a great believer that even if I don't have the answer or Jacob doesn't have the answer, somebody's got an answer for you that will help you. So there's always hope. Throwing your hands up and giving up, yes, you always have the right to do that, but I don't find that a very viable strategy.
Here's another question about, we've had a couple about ultraviolet and also ozone therapy. Are you familiar with either of those, and what's your opinion?
I probably answer is we both are. First of all, let me talk about ozone more specifically. There's some recent work by a number of physicians who are telling us that ozone alone used in high doses may be curative of Lyme disease. We're extremely excited about that possibility because that would mean that we might be able to treat Lyme disease or all of these infections without resorting to antibiotics. Whether that's true or not, however, it's premature to be able to say that. So at least at our clinic, we do use ozone. We use it in a variety of ways. As awful as it sounds, we use it rectally because it has some very good detoxifying properties. We use it intravenously, et cetera. Is it a good product? Yep. What's its role? We're still figuring that out. Ultraviolet is a very different treatment and is much less specific.
Okay. Here is a person who's, it can be good to know. Here's a woman who was 8 months pregnant and had an engorged tick on her arm. She then got the bull's eye rash and was on amoxicillin for 1 to 2 weeks. She feels like she's okay, but her daughter, whom she was pregnant with, has always had a weak immune system fatigue, and other issues. What's your thoughts on that?
Well, I think I clearly said that 1 or 2 weeks of treatment is not adequate, and we do know that Lyme can be transmitted vertically, meaning it can and is often passed from mother to offspring. So one of the things that we know something about is that when we know that a mother has Lyme disease, if she takes antibiotics throughout her pregnancy, even in low dose, the vertical transmission has been shown to be virtually zero. So unfortunately, I don't think that the 2 weeks of antibiotics that she received was adequate, and you do need to worry about it being passed on to the child because it's a common way it can be acquired. Sorry about that.
So probably a good idea to get evaluated.
I would note, too, that if there's a lot of gut symptoms like colicky kind of things, ear infections, also treat the candida with an nystatin, because there may have been a piece of that going on even from the antibiotics that late in the pregnancy.
Here's a person who spent 3 weeks in Haiti back in 2005 and was bitten by some kind of bug, has no idea what it was on her foot. It got swollen and pus-filled due to the friction of the shoe, but didn't begin to feel any obvious bad health issues for over 1.5 years. Could that be Lyme's disease or some other insect-transmitted disease?
The simple answer is yes. I don't think we can say what it is from that description. Lyme typically does not cause pus-type infections, but could some infectious disease have been transmitted at that time? Yeah, it's a distinct possibility.
But again, the 1.5 years later, it should be considered, but it's not the number one horse in the running. You want to look at the whole picture again. That's one piece of the picture to look at. If it had been 2 weeks later, even a month and a half later, it would be higher up in the probabilities. But 1.5 years, that's kind of a long incubation time. You can see it. But it would not be the top consideration. It would be one consideration.
Let me disagree. About time we disagree. Let's have some good, healthy disagreement. We often think that people can be bitten by a tick, and if their immune system is fine, it won't do anything. I mean, not everyone who gets bitten by a tick gets Lyme 3 days later. It doesn't work that way. Many of the Lyme experts, particularly Joe Brascano, who's considered the dean of this, believes that people are bitten by a tick, life is good, they do fine. 10, 15, 20 years later, their immune system is churning away, it's doing great. Again, this is about the immune system. If there is a stressor, which Jacob talked about beautifully in his talk, it can be pregnancy, it can be surgery, it can be a severe infection, it can be an emotional event, doesn't matter what the stressor is. If that weakens the immune system to the point that it loses containment, any old infection can fire back up again. So we often find Lyme popping up years after exposure. And that, to me, is true of viral infections. It's true of Epstein-Barr and HHV. I mean, all of the opportunistic infections that we concern ourselves with in chronic fatigue and fibromyalgia can be delayed in their onset.
See, Neil, you're agreeing with me again. You're agreeing with me again. Because, again,
good.
what I'm saying is that it's not this bug bite that caused it. It was something else in terms of the immune system going down. And once the immune system goes down, you have a jailbreak of literally dozens of different bug prisoners that have been sequestered by the body. So to me, it's not a matter of chasing every single bug down. It's a matter, and some bugs need to be chased down, but others, it's a matter of optimizing the immune function and treating the underlying problems that cause the immune system to go down so that the immune system can recover, because it knows how to do search and destroy missions on all of these different critters. So that it was 1.5 years later, again, to me, suggests that the bug by itself, the word that you use, opportunistic, is really critical. The definition of that is an infection that will not survive a healthy immune system. So by definition, if it's something that didn't pop up for 1.5 years, odds are it's not going to survive a healthy immune system. And I may go after these things, and I may also use NAET to treat for possible toxins from the bug bite, although that's usually going to be if it's a quicker onset. But my main focus, I will go after infections, but my key focus will be getting the immune system back and running again so it can go after all of these infections. So we're still agreeing, Neil.
We are, and underneath this, and I do need to get off pretty soon because I've got an office to get to, but underneath this, Jacob's point is critical, that antibiotics don't cure infections. I know people think they do, but if you have pneumonia and you take an antibiotic, what it's doing is it's knocking down the population of bugs to the point that your immune system can take over, mop up, and finish the job. So it is an intact immune system that ultimately is going to do this job no matter what form we're going to look at it in. And
I have to get one more question in because
okay.
I think it's a very good question, and I hadn't thought of this before. If you have chronic Lyme's or if you're infected with Lyme's, can you give that to other people, especially people you're in close contact with?
The answer is very controversial, and we think yes. I'll give you a scary answer. Sorry about it. It'll be my parting words. The Lyme spirochete has been found in every body secretion. It's been found in blood, urine, sweat, tears, vaginal secretions, sperm, breast milk. The Lyme bacteria can get to all those places. And just a month ago, there was a research report confirming our suspicion for the first time that we believe that Lyme can be passed sexually. Not to the extent that syphilis is or gonorrhea, but to a certain extent we believe that Lyme can be sexually transmitted, so that, yes, we think it can be given to one's partner. We find a much higher incidence of Lyme in our patients' spouses and families than you would think of otherwise. And I do need to run. I appreciate you all for taking part and participating. I hope this has been interesting, and have a wonderful day. Take care.
Thanks so much, Dr. Nathan.
You're welcome.
Yeah, thanks, Jim. Now, let me give one other thought with that. On the other hand, even though we see perhaps statistically more common in one partner if a spouse has CFS or fibro, the vast majority of people who I've treated, their spouses do not have it. Most often, when I see it, it's because the stress has been so overwhelming that one's picked up for both of the partners that they then crash and burn. So even though many things may be transmittable in that way, I'd say the odds of you killing your partner in a car crash are probably greater than the odds of you're giving them Lyme, so or any of the other 100 infections that have been thought about in this disease. So the bottom line is, even though is it possible? Yes. Is it possible you may kill them when your blood sugar drops? Yes. Is it likely that you're going to give them whatever you got? No. Conceivable, yes. Probable, no. So no claiming celibacy on account of what Neil just said.
So it's something to consider, but it's a rare occurrence.
Yes, there's so many other things that can kill your partner before that it's not high on the list of things I'd worry about.
Well, we've had just a lot of questions, and we're not going to have time to get to all of them today. I do want to reiterate to folks that thank you so much for your interest, and many of you have put forth, could this cause Lyme's disease, could that cause Lyme's disease, and listing symptoms and that sort of thing, but it really is impossible to diagnose over a webinar and to come up with effective treatments. And so I think that the probably blanket answer is, if you're concerned enough to ask the question, you probably need to have it looked into professionally. Would you agree with that, Dr. Teitelbaum?
I think that makes sense. And again, I do consultations with people from all over the world, some in person, most by phone, and we're happy to help you get well. You need the 3 to 4 hours to really assess each person's case and do it properly. But most people can get effective treatment, and whether you're seeing myself or Dr. Nathan or the two of us in combination, this is very treatable illness. And for those who can't afford, to go to a CFS specialist, see your local doctor. Don't, when they kind of scratch your head and look at you like you're crazy, just ignore that. At least they've ruled out the dangerous things. And then the free energy analysis program at unfatigue.com can really, it'll look at the blood work and the rest if you have it. It can assess and figure out, in most cases, it does a really good job of figuring out what's going on in your case. and telling you what you need to do to get well. And then you can take that back to your local doctor. A lot of it you can do on your own, and the rest you may be able to convince your doctor to go ahead and add in the treatments you need based on the printout.
Yeah. Well, thank you so much. I really appreciate you taking time out of your busy day. And if I were your patient, I would want to see you in person because you're in beautiful Kona, Hawaii, are you not?
Oh, absolutely. So, you know, when you come, I mean, instead of my T-shirt, I'll have my Aloha shirt on like I have today. But that's about as far as I get dressed up. So.
Well, thanks again, Dr. Teitelbaum, for just a wonderful presentation. We so appreciate it. And thank you for all of you for your interest in interventions, especially natural interventions that can make a real difference in health. I want to say that our next upcoming webinar is in July, and this is going to be a real treat. Lynn Green, she's an advanced practice nurse practitioner. She has a lot of unique certifications, including as a master herbalist, and she's going to talk to us about different kitchen medicines, things that you can grow in a flower pot or a windowsill or your backyard that are easy and effective home remedies. You can register for that at terrytalksnutrition.com/webinars. Since you're attending this particular webinar, you will get notifications of our upcoming webinars. We hope that you'll be able to join us at that time. For more information, feel free to go to terrytalksnutrition.com. We have a free weekly newsletter. We never, ever trade or sell your email address, so it is safe in our hands. If you're interested in learning more about natural medicine, we send out one newsletter a week on that topic. You can also listen to recordings of past webinars on that website, and you can also directly ask Terry Lemerange your questions. If you're for a daily dose of health and inspiration, follow Terry on Twitter or find us on Facebook at facebook.com/TerryTalksNutrition. Thanks again to all of you for attending today, and until we meet again, good health to you. Bye-bye.